Hey guys, welcome to my recording about meningitis. My name is Catherine Wilson, and we're going to learn a lot today. Alright, so the first thing you're going to want to know is, what is meningitis? Meningitis is the inflammation of the meninges that can be caused by a virus, bacteria, or fungus. The meninges are the three protective membranes that you've learned about back in A&P. The meninges include the dura mater, the arachnoid mater, and the pia mater. They are made to serve as a guard to your spinal column. They're considered shock absorbers, and they cushion the nervous system. These shock absorbers are heavily supplied with pain receptors throughout. When the meninges become inflamed during meningitis due to an infection, they swell, causing pain throughout the neck and cause headaches and inflammation surrounding the brain. As noted on the last slide, meningitis can be caused by bacteria, fungus, and viruses. The first kind of meningitis we're going to talk about is viral meningitis. This can be caused by non-polio enteroviruses such as the Coxsackie virus and the echoviruses. Mumps, measles, pericovirus, and herpes virus can also cause this infection to occur. The next kind of meningitis we're going to talk about is bacterial meningitis. It can cause life-threatening septic infection within the body. It is most commonly caused by Streptococcus pneumoniae. This is the most common in adults with the highest mortality rate. And then around 1 in 10 people with bacterial meningitis will die from complications. This averages out to about 14.3% of people each year. The final type of meningitis we're going to talk about is fungal meningitis. It's a little less common, and it's not as severe as the bacterial meningitis because it doesn't cause septic infections. Some examples of this are Candida, which we've seen before in UTIs, urinary tract infections, Aspergillus, and Cryptococcus neoformans. Alright, so now we're going to talk about the symptoms of meningitis, and I went ahead and attached sepsis as well, because both of these are connected to the same infection or pathogen in the body. So I wanted to go ahead and show both sides and what both of those infections could look like. So meningitis, you're looking at a severe headache, stiff neck muscles, photosensitivity or light sensitivity, confusion, delirium, fever, rash, lethargy, seizures, etc. This is a very serious infection, and it can turn very quickly into a deathly situation. Sepsis as well can also turn into a deadly situation very quickly. It can cause a fever, mainly joint pain, limb pain. It causes pale skin, you're cold, you're breathless, lethargic, and you have a rash usually with both of these conditions. Alright, so now we're going to talk about how we're going to diagnose meningitis. The main way we're going to diagnose is through a lumbar puncture or spinal tap. It is pictured up here in the corner. You can see how they insert a needle into the spinal cavity, and they're going to withdraw the fluid. They can either do it lying or sitting down. Another way to diagnose is through a CT scan on the head. This just shows the inflammation of the brain and kind of confirms that they have something wrong causing inflammation in the brain or spinal cord. Your blood test, it can show elevated markers of inflammation or show signs that you're fighting an infection. And then your nasal swab or throat swab, this is taking a sample of your nose or throat, and it can show signs of infection through your mucus. Alright, so now we're going to talk about treatment options for these different types of meningitis. Antibiotic therapy, we already know that it's for bacterial infections. So we're going to start with a broad spectrum antibiotic. We're going to test the cerebrospinal fluid and determine if the correct antimicrobial has been prescribed. Antiviral therapy will be used for viral meningitis. It's going to kind of control the symptoms. Antifungals, we're going to use it to decrease the fungal infection within the body. And then corticosteroids, they're there to decrease the inflammation throughout the body, so that'll help with the swelling around the brain and the spinal cord. So as we've learned, meningitis can be pretty serious. It has some long-lasting side effects or complications that we'll go over here in a second. But I first wanted to talk about how long it'll take for symptoms of mild bacterial or viral meningitis to go away. It'll take a couple days to a few weeks, depending on the treatment plan, how soon you got treated, etc. So some longer lasting complications include increased intracranial pressure. This is tested in regards to encephalitis. Like if you're concerned about the brain itself swelling, then we need to get that intracranial pressure tested. Hydrocephalus is an abnormal buildup of cerebral spinal fluid in the brain's ventricles. It causes pressure on the tissues surrounding the brain. It can cause a headache like all the time. And then cerebrovascular complications and neurological deficits are also common with meningitis infections. Some risk factors to think about with meningitis are sickle cell disease, a weakened immune system, renal insufficiency or failure, CSF leaks, age. Adults over 65 and children under 5 are at the highest risk for developing meningitis. It's severe in older adults and babies. Traveling internationally may allow exposure to meningitis-causing bacteria, and trauma to the brain or spinal cord. It could be surgery, or you could have a traumatic event cause the brain injury. All right, how is meningitis spread? So meningitis cannot actually be spread, but the bacteria or virus that is causing the meningitis can be spread from person to person, typically through coughing or sneezing, close proximity, or saliva. It's not naturally spread because it is the inflammation of the brain or the spinal cord tissues, or the meninges, like we talked about earlier. Like most other conditions, the best way to prevent meningitis is to get vaccinated for it. The first vaccine is the meningococcal vaccination. This vaccine prevents the major 4 strains of bacteria that can cause meningitis. The most effective version is the ACWY vaccine. Children ages 11 to 12 years old should receive this vaccine. Another vaccination available to help prevent the bacteria is the pneumococcal vaccine. This vaccine works against Streptococcus pneumoniae, which is the leading bacterial cause of meningitis. Right, some things I never considered prior to my research. I never considered how fast meningitis can become deadly. I didn't know much about meningitis prior to this presentation, so it's really been interesting for me to learn about these things. It can take as little as a few hours for a patient to begin decompensating once they're in the hospital with meningitis. It can eventually lead to death. Typically day 1 and 2 are milder symptoms, like you've got your headache and your stiff neck. And then day 3 is when the fever and all the other symptoms start to really ramp up in patients. I find it fascinating that pathogens are able to enter the bloodstream or other portals of entry and cause the inflammation of the meninges. They are vital for our life, so it's really interesting that a pathogen can just get in there and take over, you know what I mean? Meningitis is not a condition that I ever want to experience, but through this project, I've learned how I can better take care of my future patients with this condition. Right, why did I pick this pathogen? I don't have any personal experience surrounding meningitis. However, I've always been interested in learning more about it and what it is. The first time I heard about it was with my CNA teacher. She had meningitis and she was in ICU for a couple of weeks. So that was really interesting to me, but I didn't know what it was at the time. So now that I know it's really severe, I feel for her in that way. I learned that meningitis itself is not a pathogen. Rather, it is caused by a pathogen in most cases.